So I'm Chichi Ijeomah. I'm an intern with Leadership Initiatives. Will you allow
Okay.
me to see the patient?
Yes.
Thank you.
Yeah. There's a patient.
Okay. Hi, I'm Chichi. I already mentioned I'm an intern with Leadership Initiatives. I'm here to diagnose and treat you. So would you mind me asking you a couple of questions?
Yeah, go on. It's okay. You say you should go on.
Okay, yes, okay. Thank you. So tell me a little bit about yourself.
Ce gaya mata kai waye, me sunanka, shekarunka. Then, okay, shekarunka. Okay, makaranta fa. Makaranta fa. Okay, just two. Okay, he is Suleiman Salihu. He is 15 years old and he's a student in junior secondary school level 2. Yes.
Okay, so can you tell me about your family life?
Okay. Yau, wai tana tambaya gidanku kamar ya rayuwanka da 'yan uwanka ku nawa ne? Kamar ku nawa a gida matan babanku nawa ka gani ku nawa ne a gida? Kai ne na nawa? Hmm. Okay. Matan babanku nawa? Okay. He said he is the seventh of 19 children in a
Okay.
polygamous setting.
Okay. Okay, great. Do you have an occupation or a job?
Ke kana wani aiki ne sana'a? Okay. He's an apprentice actually in
Okay.
carpentry. Yes.
Oh, okay. That's good. That's good.
Mm.
Okay, so would you mind telling me why you've come in today or the reason for your visit?
So, okay. So me yake damunka? Mm-hmm. Mm-hmm. Okay. Tell me. Okay. He said he has headache,
Hmm.
fever,
Hmm.
abdominal pain, and generalized body pains.
Okay. How would she describe her fever? Would she describe it as, always increasing, or does it, increase at one point of the day and then come back to normal?
Okay. He's a he. Sorry. He's a he, not a she.
Oh, I'm so sorry. So sorry.
No problem. Ya zazzaɓinka? Ka gane ya yake yana tafiya yana zuwa ne ko kullum yana nan? Okay. He said the fever is on and off and is
Mm.
worst or severe during in the evening.
Okay. So do you have any vomiting or any diarrhea?
Ce akwai amai, zawo fa. No?
No? Okay. And how would you describe your headache? Would you describe it as generalized or is it sharp in one area?
Yawwa ta ce to ya ciwon kai duka ne yake ma ko kuma wani waje ne yake? Ina? Okay. He said it's generalized, but it's more at the frontal region.
Okay. Do you experience any drowsiness or weakness?
Akwai jiri ne ko mutuwan jiki? Okay. He said there is dizziness, but the body weakness is mild.
Okay. Okay. So I am actually going to go ahead and run a blood culture test. So,
Okay. Ta ce za ta yi gwajin jini, za ta ma gwajin jini. For what? Sorry?
so I suspect that they might have typhoid fever, but I just wanted to be sure.
Okay. Ta ce za ta ma gwajin jini saboda tana tunanin kana da typhoid fever. Ka gane? Ka girgiza kai in ka gane. Okay, you say it's okay.
Okay.
So, what you said blood culture? Sorry, what was the
Yes.
test again? Okay,
Yes.
blood
Blood
culture.
culture for typhoid. Yes.
Yes, it's actually positive.
Okay.
Yes, but
Yes.
we didn't do blood culture. Actually, the test we did was a widal screening test for the
Okay.
typhoid fever, which is positive. It's having a high titer, significant titer.
Okay.
Yes.
Okay. Um, so just to kind of, wrap things up, so do they feel any, or would they describe themselves as, feeling faint or pale? You don't appear to be pale, but I just want to, make sure I'm not leaving out anything. So are there
Okay.
any other symptoms that I missed out?
Okay. Yes, you have tried a lot. You have asked about anorexia, even though you didn't ask about anorexia, nausea, but you asked about vomiting, abdominal pain, which you said there is abdominal pain but no vomiting. You made mention that there is generalized body weakness, fever. You
Mhm.
understand. Apart from the typhoid fever, I think you should consider malaria too.
Yes, I did at one point consider malaria. I actually wanted to do a rapid diagnosis test as well. That's why I
Yes,
wanted to, see if there were any other symptoms.
yes. That's excellent actually. How about the malaria rapid diagnostic test was also done and is also positive?
Okay.
Yes. So is there any other test that you want to run?
No, I think that's all for tests. So
Okay.
we, yes.
The patient said he is a little bit dizzy, as you have already asked. So is there no any other tests?
Okay, if you're feeling dizzy, I would do a full blood count test to test
Mm,
for nutritional anemia.
okay. Well, that's great actually. That's good. But preferably, since you are not checking for the white blood cell count to rule out sepsis or something of that nature, it will be better if you just do hemoglobin concentration just to check for the
Okay.
PCV, the packed cell
Okay.
volume. You understand? Yes,
Okay. Yes, I will do
yes,
a hemoglobin white blood count test. Yes.
yes. Okay. So his hemoglobin count is 11 gram per DL.
Okay, 11. So it is on the border of normal, but is slightly mild. So I would slightly mild anemia. So the only thing I would suggest is to just, oh, how was their diet? That's one thing I want to ask as well.
Okay. Ya abincinka me da me ka fi ci? Hmm. Okay. His diet is more of carbohydrates and vegetables.
Okay, vegetables. So do they eat any meats?
Kana cin nama sosai? No?
No meats. Okay. Well, in that
Yes, it
case,
does.
okay. Well, in that case, I would suggest, eating a bit more leafy greens, spinach, things with a bit more iron, just to fortify and increase their blood count.
Okay, that's excellent. So how about the malaria and typhoid?
Yes. So for malaria, I will be. It appears because it's also with typhoid, it is complicated. So I would suggest IV artesunate as well as ATC to, or excuse me, ACT to complement with that. And for typhoid, I will suggest antibiotics, specifically Ciprotab. I'm not sure if they're allergic, but I would diagnose Ciprotab or prescribe Ciprotab for them as well.
Okay, let's say if he's allergic to ciprotype, what else can we give him?
Um, just antibiotics. I'm not too averse on many antibiotics,
Okay,
so
yes,
yeah,
that's good, that's good. Apart from ciprotype, you can give him amoxicillin too.
amoxicillin, yes.
Yes, and that's very great. You have really performed very well, and I'm really happy that you are doing well. But how about the preventive measures for the typhoid and malaria?
Yes, so to start off with malaria, I would suggest, wearing long sleeve clothing, long sleeve shirts, long sleeve pants, wearing mosquito repellent, using, in like bug pesticides to prevent, bugs from biting you. For typhoid, I would suggest, hygiene, that's washing your hands, making sure you stay away from people who show symptoms of typhoid, who appear to be sick, just maintaining hygiene and sanitation.
Okay, yeah, that's great. Yeah, really done well, and
Thank you.
I'm really happy for you. That's good. I think
Thank you so much.
that's wonderful.
Okay, thank you so much.
Yeah, welcome.
Okay. Bye.
Bye.